And we're seeing a lot of outcome disparities and a lot of serious problems with people losing health insurance because they've lost their jobs, and that creates kind of a spiraling effect post-COVID. And many people are highlighting and showcasing the fact that that's an artifact of our fee-for-service system. Mm-hmm. So you mentioned value-based care. Do you see post-COVID that will create any meaningful acceleration toward value-based care, or is this just something people are going to talk about? COVID will go away and maybe it'll come back, but we'll be right back where we started from.
Well, I think things will be different. I'm in terms of a transition at a systems level to value-based care. If anything, I'm afraid that it might decelerate progress in that arena with a focus more toward population health and trying to identify the next pandemic. So I do think there will be, an overused phrase now, a new normal in healthcare. One of the phrases that I'm sure you're familiar with, but I'm not sure all of the audience would be here, is crossing the chasm. And with a lot of new technologies, initially you have kind of a pioneer or innovator set of customers who are kind of at the forefront, and you might get 10 or 20% of the market using something, but then some kind of exogenous event, some kind of shock to the system accelerates that, and it crosses the chasm from being a niche product to being mainstream. And I think telemedicine, virtual care, being able to see a doctor without having to go in and check in through the waiting room, et cetera, I think that's going through a crossing the chasm moment. I think we're going to see a lot more of that. And there's a lot of opportunity there for innovation, both in delivery, in business models. So I think that will accelerate. I do think the idea of preventive care, hopefully, will be paid more attention to, and some of the disparities you talk about. But at the same time, I think this has exposed some serious problems with our population health management that's been underinvested in for now many years. And I think hopefully there will be a renewed interest and revitalization of population health level kind of issues and infrastructure.
Is the University of Indiana a state-supported school? Is that a state school?
Yes, Indiana University is public, state-supported, but as most public universities have moved in the direction of being more and more either private-funded or self-sustaining through tuition, et cetera, but still self-sustaining. And right. And a lot of the Indiana University budget is from research dollars. So,
right. We have a similar background. I work at the University of Colorado, which is a public school, and I tell people that you and I work in institutions, that is higher ed, government, sick care, and entrepreneurship, and they are four of the most resistant organizations to change. So we have a heavy lift. And I guess my question is, a lot of people post-COVID are asking, what will be the impact in higher ed, sick care, and let's say entrepreneurship education, not just from the student experience, because we've heard a lot about that. Mm-hmm. I'm interested in the teacher/producer experience, just as in sick care. We've heard a lot about the patient experience. We added the fourth doctor experience to, the outcomes we'd like to see to prevent burnout and exhaustion and worse things. Mm-hmm. So what has been your experience in those areas over the last 6 weeks to 8 weeks in terms of remote access and teaching and doing what we do, since entrepreneurship, sick care, and education are pretty high touch industries? And that now we've been forced to go high tech. So what has been your experience in the last 8 weeks?
Yeah, boy, that's such a complex set of things that you're talking about and mix. So I'll just speak very much from my own direct experience with my students, with my other colleagues. And it's been largely very positive. And for example, one of the programs I teach in is our business of medicine program. So this is not an MD, MBA where the degrees are concurrent. This is for practicing clinicians. The average age is 46, and they come from all over the country. And I teach an entrepreneurship class or a venture class in their last term as a capstone, where they have to pull together all of the different functional elements and pitch a venture concept. And we had to literally within a week before the start of the term pivot to non-in-person delivery. So typically we do have some delivery that is either online or asynchronous or synchronous in the off weeks, but once a month they come in for 2 days, and it's very intense. And there's very much of that high touch kind of feel. And we had to pivot to an online kind of format. But fortunately, for example, I was able to get some of my colleagues in the venture community to join live Zoom sessions where they could talk about the venture community. I had some angel and venture capitalist investors join, and they shared their experience in kind of a fireside chat format that was all virtual. The students did a great job delivering on their pitches through Zoom, and then got comments and feedback from an investor panel of, I don't want to say judges, but let's say mentors / feedbacks providers. Now, Kelly has been in the online education business for 20 plus years, and I've been delivering education online at the master's level through Kelly Direct for 12 years now. So I think we were fortunate in that we already had a lot of both the infrastructure, but also some of the norms of education. So I think at our level, the students were able to adapt, and the system was able to adapt and at least approximate the kind of experience they would have had if we were in person. Now, part of what facilitated that, and there's good research on this, and when we launched our online program many years ago, we did some research into it, that part of what allows for a good virtual experience is having periodic, especially at the beginning, social experiences that are high touch, where people are actually getting together. So yes, it was challenging to start classes this semester and then have to kind of pivot to a new format. I'm as concerned or even more concerned about incoming people starting a program, particularly where there hasn't been that socialization in person. And I think that's the next stage of adaptation that's going to be interesting to see is, for those in the fall that aren't meeting live, how do we establish those norms for that facilitate virtual interaction?